So when I first started doing surgery, there were two things I was really afraid of. One was that I'd screw up and that I cut some blood vessel by accident and my patient wouldn't do well. It's very terrifying being a surgeon and cutting into someone's body, especially under emergency circumstances. The other thing I was afraid of was I'd be in the middle of an emergency and I'd have to go to the bathroom. So what I would do before an operation is I'd run to the bathroom, I'd take care of business, and I'd say a prayer. I think the reason that I said a prayer and I prayed to God was to get me through the operation so that I would do a good job for my patient. I was grateful to be in the position of learning how to be a surgeon, but in those early years, just after graduating from medical school, it was actually very terrifying. The first time that I ever prayed with a patient was when I was a chief resident. This is after 4 years of training. I was standing in the pre-op holding area, waiting to bring my patient back in. The husband was sitting there with, he had a big Bible in his hand. He was a very distinguished 6'5" man. And when I was finished, I could sense that there was something that I still needed to do. So I asked him, I said, well, do you want to say a prayer? And there, right in the pre-op holding area, in a deep, booming voice, he said a prayer that everyone could hear, all the other patients, all the other doctors, all the anesthesiologists, and everyone could see me. And I was saying that very awkwardly because prayer and medicine, science and medicine, they don't really mix. And all I could think was, do you have to pray so loudly? So that was almost 20 years ago. And since that time, I've been praying. I've been praying with my patients sometimes.